One of the most misunderstood chronic health conditions is mental illness. Most people living with mental illness have abundant lives and manage very well. But there are times when a person's mental illness may intensify and affect the way they act toward themselves and others. My name is Renee, and I'm your host for the third of 3 episodes on older adult mental health. Individuals managing mental illness thrive best when caregivers provide person-centered care. Person-centered care is a way of thinking and caring that sees the person as an equal partner in planning, developing, and monitoring their care. This means putting people and their families at the center of care decisions and seeing them as experts, just like yourself.
If you're thinking about person-centered care, some of what you want to be able to be familiar with is what is important to that individual. What is the most important thing? What are some of the most important things to them? What is it that they want to do? And what are the barriers to their doing that? And it may be that they have a goal that to you seems totally unreasonable, that they want to do something that seems grandiose to you. But what are some of the small steps that they would need to take to get to that thing?
So let's learn more about person-centered care and also when it's best to call in mental health experts for help. This session comes with checklists and other materials you can print out and use in your daily work. In this session, we'll define person-centered care, provide examples of person-centered care, share advice on creating person-centered care plans, and discuss when and how to work with mental health experts. Most of us make our own choices about where we live, what we do, and whom we interact with. We enjoy this freedom, and we don't like it when we're told by someone else what to do. Unfortunately, many individuals living with mental illness don't enjoy this same freedom. Sometimes they're subjected to numbing daily routines and treatment that's determined by providers, family members, or even the court system. Persons living with mental illness are many times not viewed as equals, and they have little involvement in choosing where they live or what type of care they receive. There's a growing movement, though, to change this one-sided process. The new focus is to put the person at the center and involve them as an equal in all decisions about their life. This is called person-centered care.
So there are many benefits to having a person-centered plan with an individual. The first is that the person knows that you're considering what they prefer and what their choices are as a part of the plan. It's not you doing something to them, but you helping them in a way that they understand is because they've chosen and would prefer this style of support.
Person-centered care views patients and professionals as equals. The person is at the center of all decisions about them. When a person is involved in making decisions about their life, they're less likely to become agitated with the people in their surroundings. So, what are some features of person-centered care planning? Every person is unique. Build a relationship with the person using the whole person approach.
I think one of the most important things that you can do as a caregiver or a provider is to really get to know the person that you're serving. What is their life journey? What struggles are they dealing with? Recognize it's not easy for them. And so being there for them, even just listening to them, will deepen your ability to be helpful to them. Sometimes that's all they need.
The whole person approach helps you identify and assess the following: their coping skills when dealing with change, their social connections with family, friends, and community, and whether their social environment is safe, supportive, and stimulating, their physical needs, such as health conditions, physical activity level, nutrition, and sleep, their intellectual functioning, which looks at creative abilities and knowledge, their spiritual connection, which may give the person their sense of purpose and meaning, their occupation satisfaction from one's current or past work and volunteerism, their financial status. All these factors make up the whole person approach.
In working with people, that you consider the whole person, all of the parts of a person that make them up, from who they are spiritually, to who they are educationally, to what they've done for work in the past or if they're currently engaged in work, who they are emotionally, cognitively. You want to think about all the aspects of a person's life in order to best understand who they are.
Know that one area of life, for example, emotional coping, can influence other areas of a person's life, such as social connections. Another element of person-centered care planning is understanding that every person's concept of family is unique. Learning whom the person considers their family. Family may include birth family members, friends, work colleagues, or even healthcare professionals who the person feels close to. The family unit can have a great influence on the person and also can contribute to their care.
Families can be your ally, and a person who's living with any illness does so much better when there's a team effort. And we do the team effort pretty well in other illnesses. I mean, think about if you get a cancer diagnosis, you get the Caring Bridge site going and people are bringing meals over to the family, and you get visitors, at the hospital, or you get visitors at the transition care unit as you're rehabbing and things like that. But with mental illness, the visits aren't so often in the mental health unit. The family members feel pretty alone. First of all, they may not want to talk about it because, again, there's quite a bit of stigma and discrimination, and so they don't get all the support you would get if it was a different kind of illness.
Brainstorm with your whole team. Person-centered care planning seeks out the perspectives of many care team members, including social workers, nurses, pharmacists, nursing assistants, food service workers, and housekeepers. View a person's family as a care team partner and involve them in your brainstorming as well. Ask questions and observe. Everyone has their unique story, and you can learn a lot by simply asking questions and listening. What can you learn from their family members? What do you observe in their living environment? What you learn are cues you can use to offer motivation and hope to a person who is managing their mental illness. Listen to understand. Communication involves both listening and how you talk with others. Be clear and respectful when you ask questions rather than assume you know the answer. Don't try to correct someone if they disagree with your point of view. Instead, listen to understand. If something you say triggers a person, try saying things a different way. Change yourself. It may be you as the caregiver that needs to change how you see a situation. Consider where the person is at with their symptoms, and then meet them where they're at. Work on small steps toward more effective management of symptoms. Focus on a person's strengths. Every person has strengths, no matter how challenged their life might be. Be sure you spend time reminding a person of their life skills and strengths. For example, if you know a person enjoys helping others, make that one of the goals in the person's care plan. This doesn't mean you ignore a person's pain or challenges, but it offers hope that they are able to use their strengths to manage through their difficult situation. Teach mindfulness coping skills. Learn and teach coping skills to assist a person with challenging emotions and triggers. Mindfulness strategies, such as mindful movements and practices, can be very useful.
And everybody has some coping skills that they've learned to work with. So we need to emphasize for them the strategies that they have that are effective in managing their illness and being effective in dealing with life's challenges.
For example, a 57-year-old woman living in a high-rise building lived with paranoia and delusional beliefs. This caused her to feel unsafe in her own home. She would call her landlord requesting to move to a different apartment, believing this would increase her safety. As caregivers became aware of her fears about safety, they were able to teach her coping skills, such as deep breathing and meditation. This helped her feel safer and reduced her requests to move. Stimulate the senses. Don't overlook the importance senses play. You may find auditory supports, such as soft music, can help a person reduce their stress. Many individuals also respond positively to certain aromas. These special smells may remind someone of home or a simpler time. Touch can also be a great stress and pain reducer. A hand or body massage may help a person relax and decrease their anxiety. We have a sample person-centered care plan you can download and use as a starting point for the plans you may develop with the individuals you care for.
If you're putting together your own person-centered care plan with someone, remember to allot enough time to really get to know someone and what's going to fit into their choices and preferences in the plan, and make sure you get multiple perspectives. Who else is supporting the person, be it their family or caregivers, a psychiatrist, a primary care professional, even a mental health professional. Include as many people as possible.
When to call in mental health experts. There will be times when you'll need to call in mental health experts to help identify person-centered treatments and strategies. Seek expert mental health help when a person fails to respond to your initial care plan, when a person has complex symptoms, or when you're new to caring for someone managing mental illness.
Bring in a mental health expert when clearly the person has symptoms of an illness that's not being treated. And that this can be if someone's hearing voices or if they're expressing really paranoid thinking. Then it's important that they're being seen by a psychiatrist or some kind of a psychiatric service provider.
It's really important to consider bringing in a mental health expert when the situation that you're presented with is really complex. For example, you could have a person with multiple disorders who might also have a substance use issue. You could have a person experiencing PTSD, for example, and having extreme reactions to triggers that they're choosing to self-medicate with alcohol, for example. That would be a good situation to consider bringing in a therapist who might also have some experience working with people who have trauma and who use or abuse substances.
The mental health experts who can help with personal-centered care planning include psychiatrists, psychologists, and mental health social workers. Psychiatrists are trained medical doctors who specialize in mental illness. Psychiatrists prescribe medications, and they spend much of their time with patients on finding the right medicine and dosage to help manage their symptoms. Psychiatrists are important care planning partners. Many will come to your location for initial consultations and also stop in for follow-up visits to assess how a person is responding to their medication.
Psychiatrists do the medication part of mental illness, and they actually do understand an aging body's chemistry. They understand drug interactions, because an older adult also could be taking quite a few medications unrelated to mental health.
Sometimes you might call in a psychiatrist, for example. This would be important, particularly if medications are something that a person might be considering. Psychiatrists also tend to do a little bit of mental health therapy, so it's important to know that you might be able to do both in one professional.
Psychologists assess, diagnose, and treat mental illness disorders. They help people deal with problems ranging from short-term personal issues to severe chronic conditions. Psychologists are trained to use a variety of approaches to help individuals. Psychologists can suggest care plans to help you relate better with your patient or family members.
You know, there are some practices that come to long-term care facilities and assisted living, and actually, for lack of a better word, make house calls and have hours there. But, you know, it's really hard to get someone, from their location, like a nursing home or assisted living, to a regular appointment for talk therapy.
You could also consider bringing in a case manager, often called a social worker. A case manager can help locate resources for the person and help you understand what else is available that could be useful to a person. Maybe it's arranging transportation.
Mental health social workers are licensed professionals who treat people with mental illnesses or substance use disorders. They may work in inpatient or outpatient care settings. Mental health social workers are good at helping individuals get to the bottom of what is causing their repeated self-defeating patterns and limiting beliefs. The treatment they offer can include individual or group therapy, crisis intervention, and teaching of necessary skills for day-to-day living. Where to find mental health experts? Check first with your care team leader to see if they have a list of mental health providers they work with. County social service departments can be helpful resources since they manage a number of mental health programs across a large area. Trade and professional associations are another good referral source, and many times they're the best to recommend providers who specialize in services for older adults. We have a resource list you can download with the names of organizations you can contact to find experts in your area. How to apply what you've learned in your daily work. Your action checklist. People respond best when they're involved in making decisions about their lives. Person-centered care puts the person at the center and understands every person is unique. Person-centered care always involves the person and views the person as an equal. Person-centered care focuses on a person's strengths, not their weaknesses. A person-centered care plan may include unique approaches to meal times, living environments, and level of risk. A person-centered care plan gets input from the whole care team. Mental health experts are important partners in helping you develop person-centered care plans.
Person-centered care planning is about the individual, and it's important that that person is an equal and actually is in charge of their care plan. So engage them in things that will work for them, not just things that you think will work for them, but things that they are motivated to try.
We hope this episode gives you the confidence to begin developing person-centered care plans for the older adults you care for. Be sure to download the Person-Centered Care planning resources and tip sheets we've prepared for you. This video is funded by the Stratus Health Building Healthier Communities program.